Hi, we are presenting on naloxone accessibility in Marion County. Our program does not aim to completely fix substance abuse in Marion County, but to instead fill one small gap, which is to improve access to naloxone, which literally saves lives in seconds while someone is experiencing an overdose. Next slide. To begin with, I'll just give us a quick little outline. We'll start with an introduction, then we'll have an explanation of intervention. We'll look at the population targeted, mention the justification for the intervention, review the history and theory, look at the stakeholders, then talk about the plan for the intervention evaluation, mention the timeline, division of labor, and then finally budget.
So to start off, we just wanted to mention that in 2018, data showed that every day, 128 people in the United States die after overdosing on opioids.
70% of overdose deaths were a result of opioid abuse in Oregon. An average of 5 Oregonians die every week from opioid misuse. 52% of opioid users or witnesses are less likely to call 911 or fear of police intervention. 1,462 homeless people live in Marion and Polk counties.
So what is substance abuse? From the World Health Organization page, we got that substance abuse refers to harmful or hazardous use of psychoactive substances, including alcohol and illicit drugs. For the explanation of our intervention, we just wanted to talk about what is naloxone, also known as Narcan. So it is a medication that works on opioid drugs, including heroin and morphine. It is available as a nasal spray by pharmacists, physicians, and first responders. And the way it works is that it quickly blocks the deadly respiratory suppression caused by heroin, methadone, and narcotic pain pills. Our proposal calls to make naloxone available to all communities, and we are focusing on homeless at an equitable price and access. Our mission is to help save the lives of the individuals struggling with opioid abuse and the families and individuals who surround them. Our target population is homeless. Our goal is to target this population because it lacks the resources and knowledge of naloxone. Our objective is to educate these communities about the correct usage of naloxone and where it is available. We hope to partner with Arches and Church in the Park to make it accessible and free so that we can help start the decline of opioid-related deaths.
So our goals for this intervention would be first to help save the lives of the homeless and decrease the death related to opioid overdose. Our second goal is to serve as a model for other counties and states. Our third goal is to advocate for the populations at risk. So why is there a need for naloxone accessibility? So first, homeless folk cannot usually afford to pay for the naloxone, which is available at local pharmacies for $20 to $100. Also, most medical insurances cover the cost of naloxone, so people who do not have health insurance would not be able to receive this life-saving medication. As well as having our distribution site at Arches, we wanted to include Church in the Park because we understand that a lot of our targeted population are located along the I-5 corridor and would not be physically able of traveling to the downtown Arches site. By having 2 distribution sites, we can reach a larger homeless population. Third, something new we wanted to add to our intervention is handing out pamphlets. The information that would be included is how to recognize an opioid overdose, the next steps on what to do in case of an opioid overdose, and how to administer the naloxone. The pamphlets would be in different languages because we want to address the different languages that are spoken in Marion County, and therefore have the pamphlets utilized by as many as possible. So just some brief history. In the history of substance abuse prevention and treatment, harm reduction programs have existed for opioids. Harm reduction is a set of policies and practices intended to reduce the negative effects of drugs and alcohol. So what is being done already in Marion County? So Marion County Health and Human Services has established a Narcan distribution program. This program coordinates with local law enforcement, first responders, and treatment services to distribute and track supplies of Narcan nasal spray. The requirements to participate is one must be a first responder, local law enforcement, fire rescue, EMS, or local health services. and also that they cannot distribute Narcan to the general public. So some evolution of naloxone. So naloxone was first hit the market in 2015. This was an injectable medicine that required training by EMS and could only be administered when 911 was called. This limited who would receive the drug. Therefore, there was an immediate growing awareness that there was a need for users and family members of opioid users to have access to this medication. Family members are typically the first ones to seek medical attention and be present during an overdose, according to the OHA. Then the nasal spray came out and rapidly changed the rate of opioid overdose-related deaths. According to the OHA, prior to the nasal spray, the rise in opioid overdose-related deaths was on the rise. An average of 5 Oregonians die every week from prescription opioid misuse. Next slide. So the eco-social theory guided our intervention by having us consider the social determinants of health, such as economic stability, physical environment, and the healthcare system. Those who are homeless do not have the economic means to purchase naloxone at the pharmacies, nor do they have a stable housing situation or means of transportation to reach just one distribution site. The homeless do not have health insurance or a primary care provider to help them with their opioid abuse. In addition, there may be language barriers for some that can hinder them receiving certain services or knowing where naloxone can be found.
So I'm now going to be discussing the stakeholders that are involved with this intervention. The primary stakeholders for this proposal are going to be people with substance abuse problems. As we've mentioned before, this intervention specifically focuses on those who use opioids. Furthermore, this community we're specifically focusing on is the homeless population, who are more likely to be uninsured and not able to afford Narcan. Next one. Next, we decided to focus on friends and family of people who are substance abusers. This is particularly necessary because another person needs to be there to activate the Narcan nasal spray during an overdose. And this is a highly recommended strategy by public health officials. Next page. Our next stakeholders that are really important for this intervention are the social service agencies that we'll be working with. We specifically looked at Arches and Church in the Park. These programs already serve Marion County's homeless population. Arches already has a Narcan program with Marion County Health and Human Service in place, and we've already mentioned this. However, they only give Narcan to the Arches staff. So we plan on expanding this so that we can distribute directly to the community. These agencies will also serve as the two main locations for the community members to obtain the free Narcan. And these agencies will also provide the multilingual pamphlets with the information on Narcan uses and substance abuse. We will also plan on partnering with local public health departments. Specifically, we are looking at Marion County Public Health Department and Oregon Health Authority. These partnerships will help with the continuation of this intervention so that we can take a sustainability approach. They may aid in restocking the supplies like naloxone and information pamphlets for the community. And this will be critical to the success of this and all future related interventions. Lastly, we wanted to look at the Marion County community as a whole. They may pose to hinder the intervention because they may feel that the intervention actually incentivizes further drug use. And there might be other concerns with future crimes and costs associated with the intervention. The community support is really necessary in order to successfully implement this intervention, so it's essential to be clear with the community what this intervention is and is not in order to get them to support it. Next slide.
Evaluation of the intervention includes a combination of surveying the target population, as well as members of the organizations we will work with to gauge from their perspective how effective our intervention was in accomplishing our goals, as well as how it was executed overall. Beyond this, we will regularly be monitoring statistics to opioid-related deaths and hospitalizations in the county provided by OHA and the Marion County Health and Human Services Department. Next slide. For us to consider our intervention successful, we should notice a downward trend of opioid-related deaths and hospitalizations as reported by Marion County and the OHA during the 12 months of our intervention being in progress. As well as looking at the data published, we will take into account the responses of our surveys delivered to our target population, as well as the stakeholders involved with Church of the Park and Arches. Next slide.
All right, so this portion of the presentation focuses on our timeline for the year over which the funding will be spread, as well as the division of labor throughout that year. This chart might seem somewhat empty, but that's not random, because our proposal at its core is essentially just providing naloxone to Marion County and then sitting back to count how many people are able to engage in the program. Of course, that's massively oversimplified. So to begin, we'll of course meet with the stakeholders involved in order to plan out the logistics of where and who will distribute the naloxone. We do plan on hiring a part-time employee to work 1 shift per week at Arches to provide assistance as needed and to facilitate communication between ourselves, Arches, and other stakeholders. For example, local law enforcement, social service providers, or Reverse Overdose Oregon. After they've been hired, we'll make naloxone available at Arches during their normal hours, which I believe are 8:30 to 4:30 Monday through Friday. And after a few weeks of that, our part-time employee will be tasked with administering a relatively informal survey of the recipients of the program, the actual naloxone users, their friends and family, as we're able to access those people, as well as the distributors of the naloxone, in order to get a general sense of how the program is functioning. After making appropriate adjustments based off of the survey results, our part-time employee would then oversee the extension of our program to include Church at the Park. As previously discussed, this is likely an area where people who stand to benefit most from naloxone distribution are to be located. Most likely people who are along I-5 for the most part, who might not venture into the downtown area, or who maybe cannot venture into the downtown area. Ideally, with rolling out the program first at Arches before moving to Church at the Park, any potential logistical problems or other issues will have been fettered out. Another survey will be conducted 1 month after Church at the Park is added to the program to perform the same purpose as the first survey, which is to address naloxone distribution at the new location. And the final objective on our timeline is the exit survey of sorts, which is to be conducted after 10 months of the program running. Apart from the part-time employee that we'll hire, the majority of the labor for the distribution program will come from employees and volunteers already positioned at Arches and at Church at the Park. These are people like Christy Hughes, for example, who spoke with Professor Basu's ethics course earlier this semester about her passion for Arches and her central motivation, which is love. People like Christy are the perfect candidates for the part-time individual that we're looking to hire. This is someone with lots of drive, lots of energy, and someone who certainly already knows this community inside and out. That's why we think it's so important to consult some of the stakeholders before hiring this person. It's likely they already know of someone who fits the bill and could use some part-time work. Next slide.
Our budget of $25,000 will be fully maxed out with our intervention. The purchasing of naloxone will cost about $21,400, even at wholesale prices, which are the best that we could find. Then $3,000 will be allocated to pay our part-time worker that is going to be managing day-to-day operations. Educational pamphlets that we will be printing out and handing out to the community will cost about $500, and the evaluation survey will only cost $100 for a grand total of $25,000.
Thank you so much for listening. Are there any questions?